Once again, thank you so much for joining us for the 4ST Partnership Fund info session. Let me begin the session. My name is Jolina and I'm representing the Majority Trust today. Also short form is TMT. So TMT is the co-administrator for the 4ST Partnership Fund together with NCSS. So later on, you will also hear from my NCSS colleagues in the presentation. This was an overview of what we will be sharing today for the info session. At any point in time, if you have any question, feel free to write it down using the chat box function. Otherwise, we have also allocated time at the end of the sharing for you to ask your questions. To give everyone a background on the 4ST Partnership Fund, the name 4ST came from this Social Service Sector Strategic Trust. So it refers to a 5-year social service roadmap that was first launched in 2017, and it was refreshed in 2022 with an addition of a new trust, the fourth trust. So it also refers to 4 strategic trusts that we have for the social service sector, and it marks a roadmap and a shared vision that we have. So with this in mind, the 4ST Partnership Fund is designed to support projects that meets these 4 criteria. They are being innovative, collaborative, empowering, and strategic. So this ties in with the roadmap that you see earlier on what we are trying to achieve for the 4ST. And there are resources available on NCSS website to provide you some guides on how you could achieve this. And we will also be sharing more about what we are looking out for in terms of these 4 criteria. In a nutshell, the objective of the fund is to provide funding for the social service sector to implement and achieve the vision of the refreshed social service sector strategic trust for better client outcomes. There are 2 funding categories that you can apply for. The first one, the seed category, we are looking out for projects that is up to a maximum of 10,000 per year, for a period of 1 year, and we can fund up to 100% of the project's operating expenditure. For the seed category, we are looking out for ideas or projects that have the potential to meet a need in the sector and would like to test their concept. Solutions must feature partnerships between 2 or more parties. For the growth category, it also must have partnership between 2 or more parties, but the lead applicant must be an NCSS member with IPC status. Non-NCSS members, including social enterprises and ground-up groups, could also apply as a co-applicant. For the growth category, funding quantum is up to a maximum of 400,000 per year, up to a maximum duration of 3 years. In addition, there is also an evaluation budget of up to 80,000 that approved project could tap on to use to engage research companies or for internal research to reimburse internal research resources to cover the evaluation cost. And overall, the funding will cover up to 90% of the project's operating expenditure. The growth category will support initiatives that have a working proof of concept and would like to further develop and test their solution, or initiatives that have a proven model and would like to scale. The deliverables for the seed category would be that at the end of the project that you are able to articulate your proof of concept and be able to present a report on the learnings and insight that you have gained that could be used to share with the wider sector and also used to improve your solution. For the growth category, approved project or supported projects must adopt the NCSS service standards in service delivery. So more information about the service standards can be found on NCSS website. There is a service standards playbook to help guide you through the process. Supported projects must also achieve outcomes under the sector evaluation framework, which we will be sharing more details at the later part of today. Projects that tap on the evaluation budget must submit the evaluation research report. And lastly, for projects that are supported to scale, must complete the Organizational Health Framework for Social Services Self-Assessment, which is a checklist for organization health to help you identify some strengths and weaknesses that you can work on to build your organization. So at this slide, there is also a QR code here that you could scan to access more resources. We'll move on to the evaluation matrix. For the seed projects will be evaluated on the gap identification, whether there are credible evidence for the gap that you identified, whether there's clear explanation of how the project addresses the gap. It will also be evaluated on the project design. And we hope to see that the approach is supported by evidence, including end user research and data. Projects will be evaluated on the ICES components, meaning the innovative, collaborative, empowering, and strategic. The key team's capacity, whether the team has relevant experience and capability, and also whether the project is feasible and has the potential to scale. Evaluation matrix for the grow category is similar, with the addition of a project monitoring criteria, whether you are able to select suitable output and outcomes to measure impact. And we strongly encourage you to develop a theory of change to show how do you identify the output and outcomes indicators. The project must also show that you are able to, they have potential to sustain beyond the funding period, noting that the growth category can only fund up to 3 years of funding. And we want to see that some data points that you can illustrate that there's a potential to sustain beyond the funding period. With that, I will hand over to my NCS colleague Delis to continue and share more about the strategic areas.
Thanks, Jolina. I'm Delis. So I'm here to share a few areas that we hope that the solutions that you propose will target. So first, it is looking at upstream support for low-income families, in particular early intervention for children and youth. So the research still shows that there is a clear risk for children and youth with adverse childhood experiences. So we call it ACEs for short. So one study showed that there's a 63.9% lifetime prevalence rate of ACEs in a nationally representative sample. So the research indicates that there's increased risk of poor outcomes, especially in areas of sexual risk-taking, mental illness, substance abuse, and self-harm. So to quote the study, an exposure to 3 or more of these ACEs was associated with a near 5-fold higher risk of experiencing positive psychotic symptoms. However, there's some promise in the mitigating effect of perceived social support. So measures which make one feel like they have someone to count on or someone to call upon for help does reduce a chance of later life depressive symptoms. Moreover, given the familial context and the importance of the home environment for ACEs, we found that dual generation and family-centered interventions are key for a sustained effect. So the intervention that we consider, it should consider the individual as part of the family unit rather than focusing on measures on the individual. So we are interested in supporting low-income families who fall into the risk profiles as highlighted in on the slide. And we invite proposals that should bring about more positive psychological well-being, social emotional competencies, and improved family functioning and relationships. So programs that you propose should prioritize early intervention, which could include early outreach and identification, assessment, and intervention for upstream issues. So we are interested in upstream support. The proposals should not duplicate or reinvent programs that are remedial in nature. So please, we invite all applicants to share your research and practice data with us to outline key pathways of risk and propose ideas for upstream intervention. So moving on to the second area, is employment support for persons with mental health conditions. So we all know that employment support remains an area of need. There's only a handful of service providers providing systematic employment support. So through our experience in dealing with initiatives on employment, we realize it's about the promotion of behavioral change in persons with mental health conditions. So as you can see on the slide, we promote this COM-B model, which is a renowned behavioral change framework. So there are three components. Capability means the physical, psychological ability to engage in the activity. Opportunity, whether there are sufficient opportunities for a certain behavior, and motivation, is there sufficient motivation for a certain behavior. So your scope of intervention can be in the form of advisory and consultancy support for employers to implement inclusive workplace practices, to address the uncertainty, misconceptions, lack of knowledge, and even inertia in employers to implement workplace mental wellness. You could also look at models that promote a seamless pathway of training and placement for PMHCs. So you can collaborate with agencies like Workforce Singapore, social enterprises, or private providers. We are also looking at post-employment support. So these could mean follow-ups in the period of 6 months after employment, such as on-site check-ins and doing further workplace adjustments. Yeah, so for mental health, we are also looking at peer support. This is leveraging those with lived experience to support others in recovery. So for this grant call, we are interested in two types of peer support. One is peer support in workplaces and training peer supporters to build community. So we are interested in peer support because it remains a key approach for recovery and helps reduce hospital stays. So, okay, moving on to the last area. It's about emerging needs and gaps. So we recognize that there may be some emerging trends that we should start paying attention today. So we invite proposals that leverage your practice data and knowledge to help us surface these issues. And these issues should be based on data that demonstrate an evolving or growing need due to changing demographics, technological advancements. It should also supplement the existing scan data on the problem and how it can make an existing service more evidence-informed. And that in addressing this emerging issue, it will have significant impact on this identified profile. So yeah, these are the three main strategic areas. I'll pass on to TMT colleague, Joey.
Thanks. So that was covering like the strategic areas that we're looking at for the 4ST fund. Going on, there's part of this like larger like 4 pieces of the criteria. There's C, which is collaboration. There is E, which is empowering, and there's I, which is innovative. So I'll just go through the others. So with innovative, thought to try and like kind of dig a little bit deeper as to like what we are looking for in terms of how we define innovative projects. So I think it really just comes down to the articulation of how you define and help to elaborate how your project is innovative. So of course, innovative includes new solutions, but as well, we're looking at possible adaptation of existing solutions that can tackle new problems, or the value add to an existing solution to kind of improve outcomes for your service users. What really comes down is really key is the articulation of what your project intends to do and its modality. And one way to do that is also to kind of demonstrate how existing studies, either local studies or global studies, lend to this. With the collaborative angle, I think there were a lot of questions that were previously submitted to ask a little bit about what does collaboration look like, and given this is a partnership fund. Some of the questions included what is the level of information required for submission? So I thought I'll kind of tackle some of those questions first. So in terms of the level of information that is required, one of the questions asked if an in-principle agreement between both organizations would suffice if the actual operationalizing of the program would be conducted in 2025. So when we're looking at this application, what we're looking for is a very clear idea of how the collaboration and partnership is going to look like. So an in-principle agreement might not be sufficient because we would like to see exactly how all the different partners are coming into play in terms of whether it's the co-delivery or co-location of services. So the proposal will need to be relatively well thought out such that it can be implemented within, for example, 3 to 4 months of the application being approved. you'd probably have a higher chance of having a successful application if the collaboration and the partnership is maybe thought through a little bit more deeply. But then, there's another grant call that will always happen. So it will probably be better to work on it a little bit more before submitting an application. In terms of the number of collaborators you could have, honestly, you could have anywhere from 1 to 3 collaborators. What we're really looking at is the depth of collaboration. So in this slide, you can see that there's 3 different levels. All the successful applications into 4ST were really at the level 3 type of collaboration. Quite a lot of the collaboration that we've seen in terms of applications that come in usually fall under level 2, where there's a bit of coordination or cross-referral of services. But what we're really looking to see in terms of 4ST proposals are systematic alignment of work. And what that almost looks like is, for example, if you have 3 organizations involved in the proposal, you have a lead applicant and 2 supporting partners. Technically, a very strong collaboration would almost look like any one of those 3 agencies could be the lead applicant, because there is full information sharing in between all 3 organizations. The only difference between the lead applicant and the supporting applicant is really the lead applicant is the project manager of the entire grant and works directly with NCSS to push forward the project. So this means that when you are putting in your application, you would need to articulate how the learnings that are garnered from this project will be equally kind of collected and distributed, and that knowledge is institutionalized within all 3 of those organizations involved in that partnership. And a really great step further from that is to then share what would the model that you're testing within this proposal, what would it look like if it was institutionalized into other agencies, or the model can be replicated to benefit the rest of the sector. And finally, for that, we have empowering. So for the applications that we've received in the last 2 grant call rounds, I think this is one of the, I guess, easier ones to address. Most folks who have submitted applications did meet the empowering element. So, what we're looking for is co-development or co-production of the service, and service users are actively involved in every step of the program delivery, as well as iterations for future runs of the program. I think what will really be helpful when you are presenting your proposal would be if you articulate a bit of a step-by-step process of what your service user journey is in accessing your program or the service to them. So to kind of put everything that we've just shared in context, we'll share 4 different case studies. 2 of them will be within the seed category, which Jolina had shared about before, wherein each proposal is no more than $10,000 in funding. And then 2 case studies after that will be from our grow category, which is up to $400,000 per year over a course of 3 years. So this one is under the seed category. In terms of why we see it as innovative is because we're testing out an interesting way to engage youth in a group-based setting. It's collaborative because InPart is the youth organization. WWF brings in the expertise in terms of nature and bioconservation. So from here, actually post this proposal, technically there is a model that then WWF can work with either other youth agencies or even senior agencies to do something similar. And likewise, InPart has a model of working with another agency that provides different types of expertise. So this is how the knowledge has been shared between both agencies. And it's empowering because the youth who participate in the program are then coached, and they can become youth facilitators for future runs of this. So IMPART intends to continue this with their youth groups. Next one is Ubuntu Space and Shinsugi. So it's innovative because they're combining two different modes using Lego Serious Play and journaling as a way to engage with persons with mental health, struggling with mental health. And it's collaborative because, we're using two different models and both agencies are learning from each other, and then they can then work on with different partners to kind of drive this model of working with participants. And it's empowering as well because, the nature of this project in itself, what makes it innovative is that it's empowering in that whole process. So these two case studies were at that quantum of $10,000. And then we're going into the larger quantums, which is up to $400,000 per year over 3 years. So Pro Bono SG, what it is a community law center. So Pro Bono was the lead applicant here, and their partner was the Realm of Tranquility. So that was their main partner. However, other partners that they've cited would be actually FSCs and SSAs in the area of Realm of Tranquility. What they've done is that they have set up a legal clinic, and this is actually the second legal clinic that Pro Bono has set up. They already had a successful pilot in Hougang, and they identified Woodlands, the northern part of Singapore, as another district and area where actually a lot of legal support was required and sought after. So in terms of innovation, it's an innovative solution because it brings legal aid and support directly to the community. And that way, the community lawyers are based in Woodlands and there's easy access. So then social workers and legal and legal professionals can then work together to support their clients. And then at the same time, the lawyers will get a chance to learn a bit more about, what the kind of social causes and some of the ways to better support their clients. And then social workers as well will have a better understanding of the legal system or how to better prep their clients or their families. It's collaborative because of that knowledge exchange. And then it's empowering as well because the service users would then, be able to work closely with both their social workers and the lawyers to better kind of improve the way legal help and legal aid is available to their community. A key gap in care for at-risk youth who are reluctant to seek help. So when we're talking about innovative, this is value adding on top of existing services in order to meet a gap that is there in the space. And what they are doing is that they're collaborating with KKH to have a green lane and a way for medical professionals and to work with Limitless, and so that in the community side, it can also kind of support these youth who are seeking help. In this case, it is unique and it's innovative because it enables the youth to actually access these services in a more timely and accessible manner, and it builds on existing services. So in that sense, in this case, it's the community working closely with the medical professionals to provide that care. And it actually allows, youth to journey with one single individual who will actually journey with them through the through their journey of receiving care. Because one of the gaps identified was that during this help-seeking process, if the referrals are not done with care and, taking the youth through, the chances of dropouts of seeking help is actually quite high. It's collaborative because Limitless is working directly with KKH and they will co-manage their cases. And there's a green lane for Limitless clients. And this model that they're working on after 3 years, the idea is so that KKH can work with then other agencies similar to Limitless, and Limitless would also be able to then bring this model and work with other hospitals that are keen. Empowering as well because with the youths having a key point person to journey with them through their process of seeking help, they will actually be able to make better, clearer decisions as to how they would like to seek help and get the support that they need. So these are the different case studies, and with this, I'll pass it on to colleagues.
Thank you, Joey. I'm Zishin, and I'll be running through some tips on how to better structure your proposal so that it will make it easier for us to understand what you are trying to submit, as well as for yourself. As you go through the process, it will also make it easier for you in terms of understanding what you want to convey through the proposal. So very briefly, at the start of the application form, you will see as a question asking you to summarize your project. So we have seen some examples of very vague and unclear summaries, whereby if you look at the summary, you have essentially not very much idea of what the proposal is trying to do. So for example, this summary that we see on the slides, it is just very generic about using 3 E's to nurture young hearts and help them in the future. But a better summary would be to be a bit more specific in terms of who you're collaborating with, what your project aims to do, who your target audience is. So we have provided some guidance in terms of your profile as well as the number and the key interventions and activities. So what are you aiming to do through your project, as well as the outcome, so what you are trying to achieve through the project. So this example shows how the agency is trying to collaborate with another agency to befriend youths aged 13 to 18 living in a certain area through 3 E's, education, enrichment, and excursions, and the outcomes are listed. Next, the next few slides cover the various aspects of how you can better convey your proposal. So firstly, it will be with regards to the target group. So to be as specific as possible, who exactly, what are the demographics, and also how would you recruit them through the program, be it your existing service users or building referrals with other social service agencies, as well as also identifying the needs. So what need is your proposal trying to address? How did you identify this need? Was it through a survey that you conducted? Was it through some pilot runs that you had conducted? Or through research? It could be national research, international research, as well as national trends. So one example here, of course, our slide is limited by space. So this is a very brief summary of how our applicant pro bono had administered a legal needs survey and listed the key findings. And through the key findings, top challenges were identified, which the proposal then goes on to explain how these challenges will be addressed. Next, it will be about how the project value adds to the existing landscape of services. So it is about being aware what are the existing services and schemes that are comparable or different from your project, and how can your project show that value add and differentiating factor in which you are saying that you can better meet the service users' needs, or that maybe there's no available comparable service, and then you can say that as well, and how your project can then come in to meet that gap. I've touched briefly on this just now. So basically, is if you had an ongoing pilot or a previous pilot, how did your project build on it? How did it improve on this pilot? And so the example given here was how Pro Bono had a first community law center, and their proposal was adding on to this first community law center by proposing to replicate this model in another area of Singapore. Next, it will be how the project components will address the needs and achieve the outcomes. So basically, it is a clearer linkage between the needs and gaps and the outcomes and how your project will achieve this. So this is a very, very short example, of course, limited by space in the slides, but essentially the idea is to explain how the gap or need is addressed, for example, through training social workers to identify legal needs. And as a result, the outcome is that integrated social and legal support is provided. In terms of measuring outcomes, we also hope to see suitable indicators on how the success of the project will be measured and why these indicators were chosen. In the later part of the presentation, my colleague will also share a bit more about the sector evaluation framework, which is something that NCSS is having for the sector to have a more consistent way of measuring outcomes. Overall, general tips are: write clearly, write succinctly. If you can explain a point in simple words, use simple words, go straight to the point. And also, if it benefits you, invite a third party to read your proposal to ensure that they understand your proposal, and similarly for us, we will also understand it. And of course, now ChatGPT is all the rage. So if it helps you in terms of drafting or refining your proposal, do go ahead to use such tools. Lastly, if you would need further help in terms of improving your proposal, we do have a proposal writing e-course, which is free. So you may scan the QR code to find out more. And of course, we will disseminate the slides after the session. The proposal writing course covers these following content about how to assess needs, how to design your program, monitor your program, as well as looking at manpower needs. And we hope this course will be useful for you in preparing your proposal. So now I'll pass the time on to my colleague who will be talking about the sector evaluation framework.
Thanks, Shen. Hi, everyone. Yeah, so with evaluation, I just want to start off by usually the word kind of scares people. So I have some good news. I think the sector evaluation framework is supposed to kind of help ease that. Yeah, and I hope that after my sharing today, you guys will be a little less daunted by this idea of evaluation and hope that you actually find it helpful in evaluating the outcomes of your program. So let's start off with first the context of what is the sector evaluation framework and why did NCSS come up with it? So when we talk about the sector evaluation framework, I think one of the more important things that we need to remember is how can we be able to have a common language to speak between programs across different subsectors. And that's why we thought that it's about time that we need to have a consistent and validated outcome measure, especially for all programs with the same objective. And with a common language for all the different stakeholders in the sector, what this happens is that we can better track the progress of service users and better articulate impact as well. You know, when we go for information sharing sessions or sharing of best practices, if we are able to articulate the outcomes of our program using the same metrics, it helps us to better understand and better identify what had really worked for our service users, what can be better improved, instead of looking at, hey, actually, what is your success measured by, and how can these definitions perhaps differ? So there are two parts of the sector evaluation framework. You can consider it as two sides of one coin. On one side, there are the program outcomes. So the sector evaluation framework actually provides a repository of common metrics for interventions with similar outcome. So here you will have an example of a youth program where the objective is to improve positive youth development competencies. Now, this is quite a general outcome for most of our children and youth programs. I believe if you are from a youth social service agency, you would be familiar with this as well. So we do then say that if you have such an objective, it is to be measured using the ACT SG. And then the other side of the coin would be the monitoring indicators. On one side, we have the quality of life tool, where the purpose and objective is to see how we can improve the quality of life of service users as an overarching goal of the sector. And we assess this using the WHO QOL measure. The reason why we have identified quality of life in the first place is, you know, when we talk about sector evaluation, right, it is one thing to have a common language of how to measure impact or how to measure the achievements for programs of similar objectives. It is another where we want to see how all of our collective investments in effort, in time, in resources has moved the needle for our service users. So when it comes to maybe persons with mental conditions or youth at risk or families who are vulnerable, I think at the heart of it, as a common indicator, we are all trying to improve the quality of life of our service users. And this is how we have identified the WHO framework. And I think some of you may also be familiar. NCSS has also done population-wide studies. Now, this gives us an opportunity as well to then compare for our service users against the population. So we'll see whether that gap has actually been narrowed when we do put in resources to kind of level the playing field for them as well. Yeah, so I hope you are excited to be part of this movement, I guess, to measure quality of life. Now, on the other hand, we can talk about moving the needle of quality of life. We can talk about achievements in terms of program outcomes. But at the end of it, we also want to hear from the service users how they had experienced the program. And this is why we also have the service quality questions as well. Now, you might be wondering like, oh, this sounds like there's a lot of things to measure. We have taken that into consideration when we built up the framework. And as much as possible, we have tried to reduce the number of items as well. If your application does get approved, you will be working with NCSS more closely in terms of the measures, the eventual measures that will be selected to measure the impact of your program. So what does it mean for your application? Firstly, the SEF metric is mandatory for all GROW applications. But if you're interested to put in an application for SEED, of course, you will be also free to make reference to the SEF as well if you like to use the metrics to measure the success of your program. And therefore, at the point of application, what you can do is to actually select the SEF metric that best corresponds to your program's objective. So what you see on the screen here are just some examples of the SEF metric. So you will see, for example, if your program objective is to improve family resilience, the measure would be Walsh Family Resilience Questionnaire. And it's not just psychometrics. We also acknowledge that some objectives, such as employment, are best measured using an objective measure, right? Whether or not the service user eventually gets employed and, more importantly, sustained in their employment for a period of 3 or 6 consecutive months. At this juncture, I also would like to maybe share a little bit more about objectives versus measures, because oftentimes what we hear as feedback is, oh, my program don't really target a certain objective. Does it mean this SEF metric is not relevant for me? And I think where I would challenge all applicants is to consider to what end are you trying to achieve certain impact or outcomes for your service users. For example, if you look at resilience, a lot of us would want to target building resilience in youth, but building resilience to what end? Yeah, so an example would be, okay, I want to build resilient youth so that then they can develop positively as well. So that longer term objective or the eventual objective, as a better phrase, that would be what we would be interested at a sectoral level. And therefore, your program will then also use the ACT-SG to measure the outcome. Which then ties in nicely to the next part of my sharing, which is that you are welcome to also propose additional outcome indicators, because we do only measure the SEF metric. We acknowledge that it might not best represent what your program had helped to achieve for the service users. So you may add this under others in the application form for a more holistic representation of your initiative's outcome management framework as well. So in the meantime, you can make reference to the sector evaluation framework guide. You can scan the QR code, and this provides step-by-step instructions on the 6 steps involved in outcome evaluation as well. So that actually brings us to the end of the sharing today, and we will move to question and answer, and I'll hand the time over to my colleague Joey.
Great. I think we'll just cover a couple of the kind of questions that we had received at the start. And in terms of whether you can have agencies submit multiple applications, the answer is yes. I mean, understand that, you know, there are of the different kind of strategic areas, there are 2 big buckets, and then also with emerging needs. So if you feel strongly about, you know, sharing about different gaps that you would like to plug, feel free to submit, although we do encourage you to really focus all your resources do speak with us as well, do engage with us during the process, chat with us so that we can also better understand of your different proposals, which one might seem the most quote unquote ready for this particular application cycle. In terms of the funding scope, there are questions about what it does and doesn't cover. So in terms of, I think, on the slide, 4ST does not fund, health-related, active aging, or capability building, these sorts of kind of project scopes. These types of, if you have proposals that kind of fall within these scopes, then do feel free to look at other agencies that do provide funding for such types of projects. In terms of what can be counted within the funding budget that you propose when you submit your application, anything with direct expenses, manpower, and material costs. Essentially, the rule of thumb is let us know what the gap is, what does your project entail to cover, and what's your solution, and then exactly how much resourcing is required in order to achieve those outputs and outcomes. And then that's how we would take that budget conversation forward. In terms of collaboration, couple of questions. I think one of the things that we've realized when we receive different applications and in our conversations with possible applicants is that there are varying degrees of how ready a partnership is between the co-applicants. And so I think one thing that needs to be really certain is that there is buy-in between the different partners to really come together and bring all your expertise together and craft something that is to the benefit of the end user. And so beyond an in-principle agreement of working together, I think key parts of the proposal, key steps of how you intend to work together, who's facing your service user, and then what happens after. It'll be really important to tease out all the areas in which the different partners are contributing to that journey and, that project development. And with that, not sure if there are any questions from online. How do you find the questions? Yeah. Hang on. All right, I see Samuel has a question. Samuel raised his hand.
Oh, hello. I have a question about just now in the previous slide you mentioned that.
Technical difficulties.
Oh, can you hear me?
His question doesn't come out.
Can you hear me?
Sorry, Samuel. Trying to I need to kind of adjust the audio. Samuel, could you try saying something?
Oh, testing.
Okay, I think, could you say something across?
Yes.
Yeah,
Testing.
perfect.
Okay, great.
I can hear you now.
So in the previous slide you mentioned it doesn't support health-related or active aging programs, right? What encompasses health-related? Because as a hospital, I mean, most of the products of our projects will eventually be health-related.
Mhm.
So curious, yeah.
Yeah, so I think, for example, since it depends on what your project is looking at. I think if it covers anything that's like health related, if it's seniors, for example. So what we're looking at is that if there are, for example, other agencies that provide funding that cover that scope of your project, then the first port of call would be for you to actually go to that direct other agency, if it's AIC, for example, to be able to apply for grants there. However, we recognize that's why under the strategic areas there's a category under emerging needs, because maybe there are perhaps the scope of your project doesn't fit within other funding criteria of other grants that are already available out there. And if there is a gap because there are other grants in the marketplace that's a bit more targeted towards seniors or health, but your project doesn't fit within those funding scopes, then feel free to apply for 4ST. But in your application, do articulate that you've sought other funding channels for your project and the reasons for why those funding channels might not have been the most appropriate for the project, for the proposal that you're intending to submit, and hence why 4ST is the right fund for you. Okay, thank you. Any other questions? Feel free to kind of type up your questions on the chat as well. Some of our colleagues are answering questions directly on the chat as well.
Yeah, can I mention a question? I'm the DD.
Yes.
Okay, it's a $400,000 a year over 3 years grant, right? You mentioned just now.
Yes.
Okay, so something innovative. So the presentation that you have conveyed to us, I heard you've had raised a few times. So if we have a collaborative project, if we create a new project, significant enough collaboration with another agency, the 3 years require a setup of a new team, which the grant covers in terms of manpower. So everything goes well, we got critical mass. What happens after 3 years then?
So what happens after 3 years is something that will require applicants to articulate in your application. So one of the criteria is also sustainability. So one of the things that we would encourage and highly kind of look for applicants is to articulate in the next 3 years. Yes, either you're piloting a new project, a new idea, or if you're scaling it, then what are the other pathways of funding that could be available? So if it is long-term funding from another agency, a larger agency that would benefit, then perhaps that's a sustainability plan. If it is through fundraising or even some form of revenue generation that can be incorporated into that model, then do help to flesh that out for our understanding.
So it means that what you're saying is after 3 years, the funding will end, and we need to find our own means and resource to sustain even after we hit critical mass with a team under our employment, which means getting resources beyond grants at $400,000 a year. If it's based on available funding out there, there's not much. I don't see any. If it's based on fundraising, to reach $400,000 as an IPC charity just to sustain one project as a continuity of your grant will be difficult. So I'm an executive director. I need to see it from the 3 to 5 years perspective and even longer. And resources limited as an IPC, and sustainability of the project, which from a charity point of view is heavily reliant on grants. And if we employ a team just to scale this up and hit critical mass, once the grant ends, then you will be in the red lah. So how do we look into this?
Definitely understand the concerns that you voiced in terms of challenge in terms of finding sustainable funding after the end of your project. I think I kind of want to go back to the objective of the 4ST PF grant. So really what it is to the main agenda, the main objective of the grant is to be able to bring better solutions to improve the user outcomes for service users, and through collaboration so that there's not as much duplicative work within the sector, because everyone can, has expertise that we can leverage off of each other. at the same time, I think we're also mindful of making sure that when we are funding something, we want to be responsible that when we choose to fund a project, that there is a possibility for for it to continue to sustain beyond the funding that is available from 4ST, because I think, as you mentioned, I think sustainability and funding sources is a bit of a challenge. And with 4ST, we're also looking to kind of work with the sector to create sustainable solutions. So I encourage you to have a chat with us, either myself from TMT or NCSS colleagues, to have a chat with us so that we can better understand what your proposal and what that solution is that you're thinking of actually building a team around. And let's have a chat to see what are the possible ways beyond after that 3 years. And is there a way that we can move forward to, still address the issues and the challenges on the ground, and a way that, that it will last beyond 3 years.
Okay. Thank you, Samantha. We'll do that. We'll take it offline then. Thanks.
Thank you. I have a question here, which is yeah, questions. Another question here, which is if active aging, if some senior projects are possible as well. So I think with seniors, the first thought that comes to mind would be probably AIC. And so we'll be interested to know, is the project that you're building, is there a possibility of AIC funding that can be tapped on? If it is, for example, to build a proof of, if there's already a proof of concept and you're trying to kind of build up your proof of concept so that then AIC can potentially take that model and scale it further with you. I'm just kind of painting that as an example. Then yes, we'd be interested to kind of explore that project with you. I recognize a lot of these questions that you have are probably very specific, and so I'll try my best to answer in a general way. But really, we do recommend that all of you kind of reach out to us individually and have a chat, just so that we can really kind of piece apart your application and help figure out, what's the best way to kind of present it for evaluation. Anyone have any questions? Kind of looking through the chat, and most of it has been addressed.
Hello, could I ask a question?
Yes.
So I am from Minds. It's a service agency that provides services to people with intellectual disability. So the project that I'm thinking of asking for funding for kind of falls in a gray area. So I'm wondering, maybe could I just share my idea with you, or what we are working on with my collaborator with you, and see, and let us know whether it's actually within any of the strategic trusts. Right. So so earlier there was a member who shared about program evaluation, right? So right now, what the situation that we are dealing with is that the WHO quality of life measure is actually quite difficult for our clients to answer. And so because they have intellectual disability, they might not be able to answer those questions quite, they may not comprehend the questions, essentially. So right now, me and our collaborators, which is another SSA, is trying to develop a measure of quality of life and program effectiveness that is more suitable for people with intellectual disability to answer. And so we're just wondering, so it isn't service delivery per se, but we are trying to come out with something that can better measure our services to our unique pool of clients. So would that be something that falls into this grant?
Okay, okay, can I just check that there are Okay, I just want to confirm your question. So first is that currently for your service users, the WHO quality of life questions are difficult for them. And then two, whether or not your idea of coming up with a questionnaire to better measure their outcomes can be considered as a project under the 4ST Partnership Fund. Is that correct?
Yes, correct.
Okay, so maybe I'll take the comment regarding the evaluation first, but with regards to the project scope, I'll let my colleagues answer. Okay, so for the first one, okay, so for regarding the suitability of the WHO quality of life questionnaire for very many different service user groups, not just persons with intellectual disabilities, but also very young children, for example. We do have some experience in terms of implementing the quality of life questionnaire for such service user groups. I think you know that for our population-wide studies, there was one done specifically for the disability sector as well. So in terms of the administration of the questionnaire, as much as possible, of course, if the person with intellectual disability is of a certain, how to say, like very mild level where they are able to answer, then we will really encourage self-reports. But of course, then if not possible, then we could do proxies either by the parent or the caregiver, or in the worst case situations, it will then be the social workers as well. So we do have some I guess, flexibility with regards to the administration of the tool. With regards to the project scope about whether or not coming up with an outcome metric that is suitable for the for this service user group, I believe that will be under SEED. I believe instead of a GROW, because GROW would be an intervention. I think as long as it answers the criteria, the eligibility criteria of being innovative, collaborative, empowering, as well as strategic, it should fall under. Yeah, but I will let Joey to respond to that.
Yeah, I think thanks for asking your question, because I think it's a really good example for everyone that's on the call. When we were earlier discussing in the info session, one of the categories that we do evaluate is based on whether it meets the strategic criteria within NCSS and the 4STs. So if I'm going down, down the line, doesn't meet the one on low income families, nor does it meet the one specifically on mental health. So it really falls under emerging needs. And so for anyone that's on this call or joining us here today, if, for example, your project scope doesn't fit within the first two and it falls under emerging needs, then the first thing that, because yours is with minds, you'll be looking at persons with intellectual disability. So in your application, it will be very helpful for you to reference what your engagement has been with SG Enable, for example. What are their thoughts? Because they would be more of the main key agency that your organization works with. So what does SG Enable think about the idea? And maybe is there a reason why there's no available funding pots or ways to kind of get this project through? Because I mean, from what you've just shared, it does meet a need and a gap. So if you can have those elements in your application to help us understand, okay, then if we do fund this with 4ST, and if this is SEED and a 10,000 grant, or if it's a GROW and a larger grant, then what is the next step after? Like, how are the other agencies, that your more key agencies, actually going to be involved in this project or to take it on further and the future of it?
Thank you for the answers. So I believe I have gotten the thing I'm looking for. So thank you so much.
Okay, thank you. I do know that we are kind of at 1 hour, so I just want to be mindful of time. If there are any other questions that we might have, if not, we can actually wrap up. So I think.
Hi.
Oh yes.
Hi. So sorry, I actually came here late, so I'm really sorry if I'm gonna ask some questions that I have missed out in the beginning. But I do have a question that I typed in the chat earlier. So sorry, I'm Jessie. I'm actually coming from THK Epicenter, and I'm attending this session actually on behalf of the Limestones project, which is actually a ground up initiative that that you are actually working with THK as an implementation partner. So when we are looking at submitting for this grant call, we are actually deciding between which fund to go for, you know, because there's a seed grant as well as the growth fund. And if you go by the growth fund, that means that we would have to submit the grant as THK with the main applicant, and the Limestones project as the co-applicant. So I think for this part, as we will need to clear our to get more support from the directors, right? Can we clarify the responsibilities and accountabilities of a co-applicant versus a main applicant? Because in our case, it would really be the co-applicant that is doing most of the work that answers the deliverables of the grant, while the main applicant are the ones that are signing off lah. So just wanted to have some answers there so that we can actually like clear the board.
Definitely. So in terms of like the responsibilities between the lead applicant and the co-applicant, from a very administrative, practical point of view, administratively, the lead applicant who's applying will be the one that will be liaising with NCSS or TNT during the entire like grant evaluation process. Of course, your co-applicant should join the conversations as well. Say you are successful and you do get awarded the grant, then all the monies will be dispersed directly through the lead applicant. And then that would mean that between the lead applicant and the supporting or the co-applicants, you can probably sign some form of agreement form with each other to then lay out what are the terms of your partnership with each other, as well as the flow of monies, funding, and whatnot. That's pretty much it in terms of those are really the practical considerations. And then the key difference in terms of which pot that you apply for really is the seed. Anyone can apply for it, whereas with the grow side of things, you need to be an IPC.
I understand that. Because like for our project, we actually have a proof of concept already, and we are at the second stage of our development. So we are actually thinking which one to go for, but to go for the growth fund would require a much more commitment from what I hear from you from our implementation partner, which is our like THK lah. So for that part, because you just mentioned earlier that there will need to be someone accountable from for the lead applicant side to attend all the communications with NCSS, is it?
That is correct. So yeah, we would be kind of addressing co-applicant, lead applicants together during the application process, because we want to understand, you know, how both parties are really involved with the proposal that you're submitting, as well as really to understand what are the benefits and the learnings that each agency is going to be able to take away from this project. So it sounds it sounds to me like maybe there might be a couple more conversations that you might need to have with your lead applicant. So I think definitely take the time, and would recommend that you know, in for others listening as well, is if it's at this kind of like quite early stage, then definitely take the time to really think through the full proposal, engage us, NCSS, TNT, just to understand like where, you know, you might be able to strengthen certain aspects before you submit an application.
Yes, and another point was that there is a possibility that the representative from the lead applicant is actually might be the same as the co-applicant because they are employees of in the same company. So if that's the case, is it possible if, let's say, the representatives from both the Ground Up Initiative and the lead applicant is actually from the same team?
I mean, it sounds okay. I will say that based on the more general pieces of information that you've given me, it sounds to me that in order to strengthen what you probably currently existingly have, would be to actually have another partner or another agency involved in the collaboration. Because I mean, it could almost be seen as, hey, you know, you sit on both sides. Is it really
Correct.
a full
Yeah.
collaboration, right? Is it really
We
different
actually do
teams?
have we do have plans to engage an additional like collaborators lah, but we are thinking more of like how we can enter this grant call, because the requirement is that you to submit for the growth fund, you need to submit as a non charity organization with a specific criteria. The criteria is that you have to have that LP, is it LPC
IPC.
license, IPC license, yeah. So because of that, we were thinking, you know, like we probably have to like engage the lead applicant in a way that they need to send a representative, and most likely the lead applicant will send us because we are in the same place.
Yeah, I
Yeah,
think
so-
yeah, just I'm mindful of time as well, but I think thanks so much for sharing, because I think kind of like your isn't taking yourself as an example. I think it sounds like in order to make it a stronger proposal, you'd probably need to involve another agency, which you are
okay.
saying that you have in mind to do. It sounds like you might be prioritizing time and you know the expediency of getting an application through. But you know, our recommendation from 4STPF, you know, all of us reviewing the grants, is that we would like applicants to really prioritize the quality of your proposal and really think it through. If you think, yes, you know, ideally really there should be actually 3 collaborators, but right now I only have 2 and I want to apply because I have 2 and I just want to get the ball rolling. Based on our experience and reviewing and speaking with our panels for recommendations, that does not usually lend to a high chance of success. So I think it would be better for you to really work it through and really have chats with us to let us know what you're thinking. And as you prepare for, say, the next grant call, we're happy to support in that way.
Sorry, just one last question. Is it okay if the project is receiving 2 different grants at the same time?
That is fine. We would just we'll request that you declare that as well in the application form, to say that this project it costs AB, which is a combination of A and B, and I'm getting A funding from this agency and B funding from the 4STPF fund, and that's how it's being supported.
Okay. Thank you. I'm done with my questions. Thank you.
All right. Thanks so much, everyone. Thanks for your patience and really for joining us today. Kind of just wanted to wrap up this Q&A. I think you also have an online feedback survey. But really, in terms of as you all have your projects kind of in your minds, really kind of like a thought to summarize it into a 3-step process. I think the first is really to determine what the scope of your project is and engage like your key stakeholders prior to determining if 4STPF is the appropriate fund for you. And then, you know, if you do, you know, then decide that, hey, you know, 4STPF is the appropriate fund because my proposal, after going to my different agencies, you know, there isn't quite a relevant kind of funding pot, then definitely, you know, we would love to read your application. So do submit it and kind of share with us exactly kind of your conversation and your engagement with those agencies. The second thing is, you know, once you have your proposal down, look at it against the ICES criteria, which is the innovation, collaboration, empowering, and strategic areas, which we had covered in this presentation. Definitely provide information and really articulate how your project meets those different criteria. And as best as possible, especially on the collaborative aspect of your application, really demonstrate how it's really integrating all different collaborators, the different partners into the program and in terms of the learnings and takeaways. And then finally, I know there's a lot of nuance when it comes to your proposals and a lot of questions. So I think, you know, in order to, you know, be able to, you know, for us, you know, we really want to support you guys and in putting your best foot forward when you submit your application. So definitely don't hesitate, just reach out, engage with us. We're happy to have a chat or answer any quick questions over email. And you have our contact details. If not, you can request them as well. And then thank you guys so much. Would be great if we could have some of your time to maybe scan and complete this feedback form to help us understand how we can improve in terms of sharing more about the fund and what makes a successful application. And we will follow up as well with kind of information that we shared on this deck. And likewise, you have our contact details. So if you have any further questions, feel free to reach out over email. The grant call itself is open during the month of April. We are currently in terms of working on the refining certain aspects of the application form. We've taken feedback in the last 2 grant call rounds, and we're working to add more clarity and provide more examples in the application form. So if you would like a early look into kind of overall types of questions to get a gist so that you can start preparing your application, do let us know, and then we can send that PDF across to you. However, the main application takes place over a web platform, which is called Submittable. Thank you, everyone. I really appreciate your attendance.